7:34 right now. This week marks 1 month since congestion pricing went into effect. The MTA reports that 1 million fewer cars traveled into the congestion relief zone since the toll began.
Meanwhile, undocumented New Yorkers bracing for another week of immigration enforcement raids. Manhattan Borough President Mark Levine joining us this morning to discuss these raids and these issues and more. So great to have you here.
Good morning, Dan and Hazel.
Let's begin with the ICE raids across the country. Dozens of people in our area taken into custody, thousands across the country, right? Prompting these fears now of, I guess, raids at schools and sensitive places. I had the head of the DEA for the New York office on Picks on Politics this weekend, and he almost admitted that, they're not just going after the worst of the worst, that if you were somebody who just kind of came here looking for a better life but did cross illegally, and you happen to be in an apartment building, that you're kind of just swept up in the moment. So talk about what you're doing for folks like that.
Well, even at this early stage, there have been so-called collateral detentions, where people who may actually be documented immigrants, in some cases even citizens of the United States, but of Puerto Rican origin, have been swept up in these raids. And it is creating a climate of fear that we're seeing in New York City, where attendance in the public schools is down approximately 5% relative to last year. And there's certainly anecdotal evidence that this is some families holding their kids home out of fear. This is obviously what the Trump administration attends. This is way beyond just going after people who have convictions for violent crimes. This could ripple through society here in New York City. It could tear families apart, and New York City really needs to stand up against it.
But what are you doing in particular to bring some peace of mind, if there is any, for these families?
Well, first, we're reminding people that there are sensitive locations where New York City policy does not prohibit ICE to make detentions without a judge-issued warrant, including schools. There's a lot of misconceptions that ICE can just wander through the hallways and pick people out. That's actually not how it works in New York, and we're reminding Manhattanites and people around the city that we have rules to protect people against this kind of random, untargeted apprehension that people fear.
And that's on the immigration side of things. There's also big news about the federal freeze and funding for so many nonprofits across the city right now. 2 judges have put a halt to it right now, but already people are starting to feel the ripple effect. So what kind of programs, I guess, in Manhattan in particular, because that's the borough you represent, would be affected from this?
Just another way the Trump administration is bringing chaos here to New York City. We had 24 hours last week where the entire social service sector was put into crisis because existing federal contracts were frozen. This is money that people have already spent in some cases to provide services, very important services for childcare, for rental assistance, in the medical field. And we got a reversal here. This is a win for Democrats who stood up to what would be a very harmful policy.
But it's a pause right now, right? It's a halt until it's further examined.
Yes, that's right. And we shouldn't let our guard down. But this would have a devastating impact on our economy, on government agencies, on our schools. We get $2 billion a year just for our schools. It's things like special ed, free lunches, and more. I think once people realize just how far-reaching federal funding is in New York City, they will be quite appalled at the implications of this policy. There's really no justification other than the cruelty and the chaos that really does seem to be the goal of the Trump administration.
And there really is no backup funding for these organizations and these groups that would suffer from this.
Well, in many cases, this is a significant part of their budget. Now, generally, groups that have federal funding also have city funding, and we should have a plan to help them with cash flow problems, maybe by accelerating city contracts. This has been a challenge in the best of times, but I think New York City needs to be ready to help these groups stay solvent, or we're going to lose really valuable social service providers in New York. All
right, to be continued on that front. I want to kind of zero in on more of a local issue. We heard from the new NYPD Commissioner Jessica Tisch last week at the State of the NYPD address that she gave over here at Cipriani's, and she talked about this 3-pronged approach to making the subways feel safer. How have you kind of heard from constituents about how things are looking in the subways, right? Because I know you get an earful about folks. Have the overnight patrols made a difference?
First, I really want to commend Commissioner Tisch. I think she's done a great job in the last 2 months in an agency that had been riddled with corruption and misconduct. And now she's really focusing them on making New York safer, particularly on the subways.
Yeah.
And yes, I do hear people feeling like there is some progress. There's a long way to go, I think, still. And remember that we're working against a broken mental health system.
Yeah.
that is failing to give people the long-term treatment that they need. We have way too little capacity in places like Bellevue Hospital or in the State Psychiatric Hospital on Randall's Island. So all these things go hand in hand. Yes, we need the NYPD to focus on safety. We also need the mental health system to give people the treatment they need.
And you want to reopen the mental health facility on Randall's Island?
Yes, it is open. People know this building. It's a large complex. Actually, it's multiple buildings that's been there for almost 100 years, but it's mostly empty. This hospital had 4,000 patients at its peak. Now it has 400. Actually, if you cross the Triborough Bridge at night, you'll see 2 of the 3 buildings are dark because there's nothing happening there. And so it's hard to get people admitted for long-term care who need it. And that's directly connected to the crisis on the streets. So we should expand capacity.
How would you fund that?
It is going to need state funding. Bellevue is mostly city funded.
Yeah.
Those really are the twin institutions that we need in Manhattan to get people long-term treatment. Bellevue's also got way too little capacity. The extended care unit for psychiatric patients on Bellevue has 20 beds. That's it. So clearly inadequate to the scale of the problem. We've got to fund both at the hospital level and the long-term care level, much more robust, expanded capacity.
All right, well, keep us posted on how things go with that.
I promise I will.
And appreciate you coming in today.
Thank you, Hazel. Thank you, Dan.
Good to see you.